let me look at this. Let's look at it, critically look at it, because we have a situation whereby people just marry for like 6 months, 3 months. They feel like I should have got pregnant now. So let's look at it. At what point should a couple become worried? Like I should have this pregnancy should have occurred. At what point should?
The Yorubas will say "Omo le gbeyawo."
Okay.
So ideally, every couple, it is the joy of every couple to be able to get pregnant and have their own babies. But sometimes life happens. But in the hospital, before they can start treating you for infertility, it has to be after having regular sexual intercourse for 12 months. Unprotected, regular sexual intercourse for 12 months. You're not using condom. Yes. There's no family planning. You're meeting at least 3 to 4 times a week for 12 months before we can start discussing infertility. So you cannot walk into the facility in 3 months and expect us to do no. We ask you to go back, go and meet regularly.
Okay, thank you for clarifying that. So the next thing I think I want to ask you is, we have many tests that couples do before to know that, okay, I'm having infertility of a teen. What are the tests couples should do before and during the whole struggle of the teen?
Okay, for infertility, every couple have different experience. There are different causes, so they have different tests that they need to go to. It is not a one-size-fits-all. But some of these tests that you need to do, the first one is the pelvic ultrasound.
Okay.
To assess the uterus, the ovaries. The second one is, let's say, follicular tracking, like I said. Then we'll move on to HSG.
Okay.
That is for the female parts.
Yes.
Now, coming to the male, you need to do a sperm analysis to know if you have low sperm counts, are the sperms viable, they have the correct morphology. You need that. That's basically for the male.
Okay. Thank you very much. So let's now look at the roles that ultrasound play in the fertility treatment and medication. So let's look at this. So what roles does ultrasound play in infertility investigation?
Okay. Ultrasound is a very vital tool in investigating infertility. Okay. In fact, it is one of the first line equipment that are used in diagnosing infertility, because, like I said, you have structural abnormalities that can cause infertility, maybe fibroids. You need ultrasound to be able to assess the uterus to check if it is anatomically okay. Are there any structural abnormalities? And just to even check if the lining of the uterus is okay too.
Okay. Thank you very much for this. And let's look at this one of the investigation that TTC do at times. Like we have follicular tracking, we have a pelvic ultrasound, we have a transvaginal ultrasound. So this follicular tracking of a teen, how does follicular tracking helps couple trying to conceive? How does it help?
Okay. Now, follicular tracking is simply assessing the ovaries and the eggs. Although we check the uterus during the process, but the main aim of follicular tracking is to check the eggs. Are you ovulating? Is the egg maturing? And does it rupture to release the cells? So in follicular tracking, it's not just a day scan. Okay. It is a series of scans. At least you have like 3 or 4 scans in a follicular tracking. So why is